Since last Wednesday, there has been a slight increase in our leading indicators, the positivity rate on PCR tests and virus levels in wastewater. The wastewater from data from Tuesday, March 29th and Monday, April 4th shows there is more virus circulating in a number of areas. It's not a spike that we saw in late December and early January. And in some centers, we're seeing the data fluctuate around a level that's in between the extremes of the past few months. So it's a concern, and we're monitoring it closely. But it remains to be seen how much more increase we'll see, and in particular, how that will translate into serious illness and hospital admissions.
The numbers we are sharing were updated online and are from the reporting period Tuesday, March 29th to Monday, April 4th. In those 7 days, our PCR test positivity rate ranged from 24% to 32%. As the Minister mentioned, this leading indicator is trending moderately upwards, as is the wastewater data. There are currently 990 people with COVID-19 in hospital, including 44 in the ICU. Sadly, between March 29th and April 4th, an average of just over 4 deaths per day were reported to Alberta Health. These were due to COVID-19, and my condolences go to the loved ones of these Albertans and to anyone who has lost a loved one recently from any cause. There is an additional vaccine option now available in Alberta. Novavax is a 2-dose protein subunit vaccine using the same technology as many other widely used vaccines, such as that against hepatitis B. This vaccine does not use the mRNA technology Pfizer or Moderna utilizes, and is different from viral vector vaccines such as AstraZeneca and Janssen. Novavax provides good protection against severe outcomes and is one more tool available to us for those who have a contraindication to mRNA vaccines or who prefer another option. I would also like to report, as you heard from the Minister, that children aged 6 to 11 now have another vaccine choice as well. While the use of Pfizer pediatric vaccine is preferred to Moderna to start or complete a child's immunization, for those interested in another option, the Moderna COVID-19 vaccine is now available in alignment with the recommendations of the National Advisory Committee on Immunization. Parents who wish to choose the Moderna vaccine for their child can book appointments beginning next Tuesday by calling 811.
We're not considering making any changes at this time. We do not expect to see the numbers increase in hospitalizations that will put a severe stress on the system. You know, we are watching closely what's happened in other jurisdictions. For example, if you look at the UK, the numbers, it appears that their wastewater data, or sorry, the number of cases are coming down. They plateaued in terms of hospitalizations as well, and it wasn't above what happened in the previous wave. So we're watching closely, but right at this point in time, we don't see or anticipate numbers that will or impact on hospitalizations that will require us to put measures in place. You know, this was a decision that was made between the board and Dr. Yu for Dr. Yu to depart. And this was really all about the next 5 years, not the past 6 years, right? I thank Dr. Yu for her tremendous service. She brought stability to our system and guided our system through 2 very challenging years in terms of managing COVID. But we have a big job ahead of us in terms of transformation of our system. And having a leader to be able to not only move that transformation forward this year, but be able to continue that, because it is going to be a multi-year program to be able to get surgeries within the appropriate wait times. You know, as I mentioned earlier, we're sitting at 74,000 right now. We need to get caught up. But even if we get to 68,000, which was pre-COVID, that's still far too high. So this is going to be a multi-year project to get it down. We committed as a government in our platform to be able to bring those wait times down. That remains our commitment, to be within the recommended times. We were delayed with COVID, but we are going to drive forward with this, and having leadership in place to be able to not only run through it for this year, but for years to come is critically important, and that's really what this is all about.